Do you wake up every single morning with a mouth that feels like you have been chewing on a piece of sandpaper all night long? Your tongue sticks to the roof of your mouth. There is no saliva to even swallow. You reach for water before you can say a single word. Most people brush it off as nothing serious. They think it is just part of getting older. But today, I need to tell you something that could genuinely change your health, maybe even save your life. My name is Dr. Elvric Thornwell. I have spent many years working closely with senior patients, studying how small, ignored symptoms quietly grow into major health crises. In all that time, one symptom has stood out to me more than almost any other. It is something millions of people over the age of 60 experience every single day and never talk about with their doctor. That symptom is chronic dry mouth. And what I have seen it lead to, again and again, is nothing short of alarming. Today, I am going to walk you through 7 warning signals that are hiding right behind that dry feeling in your mouth, and every single one of them deserves your full attention. Before we get into those signals, I need you to understand something important. Dry mouth is not just an inconvenience. It is not simply your body aging. The medical term for it is xerostomia, and the research surrounding it is deeply serious. Studies have now established strong connections between chronic dry mouth and conditions like aspiration pneumonia, dangerous systemic infections, malnutrition, and medication toxicity. Millions of older adults are living with this condition right now without any awareness of the risk building inside their bodies each and every day. Let me tell you about a woman named Margaret. She was 71 years old, a retired school teacher, sharp as a tack, and fiercely independent. Every morning for about 18 months, she woke up with a mouth so dry it was almost painful. Her lips would crack. Her tongue felt heavy and rough. She mentioned it once to her daughter, who handed her a glass of water and said it was probably just dehydration. Margaret believed that. She did not push it further. She did not bring it up with her doctor. She assumed it was simply what aging felt like. But over those 18 months, other things began to change for Margaret. She started losing weight without trying. Not a lot at first, just a few pounds here and there. She started having trouble swallowing her food, especially anything dry or dense. She began getting chest infections repeatedly, one after another, each one leaving her weaker than the last. Still, she connected none of it to the dry mouth she woke up with every morning. She thought these were all just separate, unrelated problems piling up the way they do when you get older. Then one morning, Margaret could not breathe properly. Her chest felt tight and heavy. Her oxygen levels dropped to a point that frightened everyone around her. She was rushed to the hospital, and the doctors told her family something they were not prepared to hear. Margaret had aspiration pneumonia, a serious and life-threatening lung infection. She spent nearly 2 weeks in the hospital. Her family sat beside her bed wondering how something this severe had crept up so quietly. Here is what had actually been happening inside Margaret's body during all those months. Without enough saliva in her mouth, her body had lost its first and most important line of natural defense. Saliva is not just moisture, it is a powerful biological system. Every night while Margaret slept, bacteria that had built up in her dry mouth were being slowly inhaled into her lungs. It happened in tiny amounts, so small she never noticed or felt it. Doctors call this micro-aspiration. Night after night after night, bacteria entered her airway and began causing damage she had absolutely no awareness of. When the hospital team reviewed Margaret's medication list, they made a discovery that stopped them cold. She was taking 5 different medications prescribed by 3 different doctors. 3 of those medications belonged to a class called anticholinergic drugs. Each one alone could reduce saliva production as a side effect. Together, their combined impact on her salivary glands was severe. Not one single physician had ever sat down and reviewed what those medications were doing to her body when taken all at the same time. This brings me to something I cannot stress enough. Saliva is one of the most underappreciated substances in the entire human body. It contains over 700 different proteins and antimicrobial compounds. It serves as immune protection, as a digestive trigger, and as a protective lining for the throat and the entire pathway food travels through. Without it, your mouth becomes an open door for bacteria, infection, and nutritional breakdown. When saliva disappears, the consequences move far beyond just feeling dry. There are over 500 medications currently known to cause dry mouth as a side effect. These include blood pressure medications, antidepressants, antihistamines, bladder medications, and many others that seniors commonly take every single day. When 2 or 3 of these medications are taken together, their effect on saliva production does not just add up, it multiplies. This is what medical professionals call the compounding xerogenic effect, and it is far more common in older adults than most doctors currently recognize or discuss. What most people do not realize is that saliva is where digestion actually begins. The moment food enters your mouth, saliva starts breaking it down and preparing it to be absorbed. When saliva is missing from that process, the body cannot properly absorb nutrients even if a person is eating 3 full meals a day. This is why many seniors with chronic dry mouth slowly develop malnutrition without any obvious reason. Their weight drops, their strength fades, their immune system weakens, and their doctors often chase these symptoms without ever identifying the real cause sitting right there in the patient's dry mouth. The bacteria living inside your mouth number in the hundreds of species. Under normal circumstances, saliva keeps a careful balance among them, suppressing the dangerous ones and supporting the harmless ones. When saliva decreases, that balance collapses. The harmful bacteria multiply without anything to stop them. These bacteria do not simply stay in the mouth. They enter the bloodstream through tiny openings in the gum tissue and travel through the body. Research has now documented their connection to inflammation of the heart, disruption of brain function, and serious damage to the immune system. Dry mouth almost never stands completely alone. That is one of the most important things I want you to take away from everything I am sharing today. In the vast majority of cases I have seen throughout my career, dry mouth is a signal, a message from the body that something else is going on underneath the surface. It is pointing at a medication problem, a systemic disease, or a combination of both. Dismissing it as normal aging is one of the most costly mistakes a person can make. Let me introduce you to someone else. His name is Robert. He was 68 years old, a retired firefighter, physically strong his whole life, and not someone who worried much about health complaints. For 2 full years, he had chronic dry mouth and never said a single word to his doctor about it. He was not worried. His mouth was dry and he drank more water. That was his solution. It was not until his dentist noticed severe and rapid tooth decay across nearly his entire mouth that anyone sat up and paid close attention. The dentist tested the bacterial levels in Robert's mouth and found them dangerously elevated. He immediately referred Robert to his physician. What followed was a series of tests that revealed something Robert had not expected at all. His cardiologist found early signs of arterial inflammation, a condition directly linked to the same oral bacteria that had been living unchecked in his mouth for 2 years. His dry mouth had been silently feeding a process that was moving toward a serious cardiovascular event. A medication review changed everything for Robert, and doctors believe it may well have prevented a heart attack. Now I want to walk you through those 7 warning signals I mentioned at the very beginning, because these are the combinations of symptoms that should make any person over 60 stop and take immediate action. The first signal is a metallic or ammonia-like smell coming from your breath. This is not ordinary bad breath from food. It is a chemical smell, almost like something industrial. When dry mouth combines with this kind of breath odor, it can indicate that your kidneys are struggling to filter waste properly. The toxins that healthy kidneys remove are instead accumulating in the bloodstream and being exhaled through the lungs. This is a signal that requires a medical evaluation without delay. The second signal is saliva that looks or feels thick, stringy, or foamy rather than clear and fluid. Healthy saliva runs thin and clean. When it becomes viscous or forms foam at the corners of the mouth, this can be an early indication of autoimmune activity in the body. Conditions like Sjogren's syndrome, lupus, and rheumatoid arthritis all affect the salivary glands in their early stages. Many people receive a diagnosis of one of these conditions years after their dry mouth first appeared because no one connected the two things together. The third signal is dry mouth that happens specifically and consistently at night, but improves during the day. If your mouth is dry when you wake up but feels reasonably normal by mid-morning, this pattern strongly suggests that you are breathing through your mouth during sleep rather than through your nose. That shift in nighttime breathing is one of the most common signs of sleep apnea, a condition that silently reduces oxygen to the brain and heart during the night and significantly increases the risk of stroke and heart disease in older adults. The fourth signal is the combination of dry mouth alongside frequent urination during the nighttime hours. If you are waking up 2, 3, or 4 times each night to use the bathroom while also waking with a dry mouth each morning, this pairing is one of the early warning patterns associated with undiagnosed or poorly controlled diabetes. The body attempts to flush excess blood sugar through urine, which leads to dehydration and dry mouth as a direct consequence. This combination should be reported to a physician and tested promptly. The fifth signal is when dry mouth appears together with persistently dry eyes. When both the mouth and the eyes lose their natural moisture at the same time, this is the hallmark presentation of Sjogren's syndrome, an autoimmune disorder that primarily affects women over the age of 50, but is frequently missed or mistaken for other conditions. Left undiagnosed, Sjogren's syndrome can progress to affect the kidneys, lungs, and nervous system. Catching it early through these two simple symptoms can make a profound difference in how well it is managed. The sixth signal is dry mouth that comes alongside frequent leg cramps, muscle twitching, or unexplained weakness in the limbs. When these two things appear together, they often point to an electrolyte imbalance in the body. Many older adults assume that drinking enough water is sufficient to stay hydrated, but the salivary glands and the muscles that function properly both depend heavily on electrolytes like potassium, magnesium, and sodium being in proper balance. Dehydration at the cellular level is entirely possible even when a person drinks several glasses of water each day. The seventh signal is dry mouth that began or became significantly worse shortly after starting a new medication. This one is critically important. If you can point to a moment when your dry mouth intensified and trace it back to a prescription change or the addition of a new drug, that is your body communicating directly with you. This is the compounding xerogenic effect in action, and it requires what is called a polypharmacy review, meaning a complete and careful evaluation of every medication you take and how those medications interact with each other inside your body. Now, I want to give you practical steps you can begin using immediately, because knowledge without action does not protect anyone. The very first thing I recommend is a simple morning mouth assessment that takes no longer than 30 seconds. Each morning before you drink anything, take a moment to notice how your mouth feels. Notice whether your saliva is thin or thick. Notice whether swallowing feels easy or difficult. Notice whether your tongue feels rough and stuck or whether it moves freely. Making this a daily habit creates a baseline for your own health that you can reference and report accurately to your doctor. The second step is a medication audit. Write down every single medication you take, including over-the-counter drugs, supplements, and vitamins, and look each one up to see whether dry mouth is listed as a side effect. You may be genuinely surprised by what you find. Bring that complete list to your next physician appointment and specifically ask whether any combination of those medications could be affecting your saliva production. Many medication adjustments can resolve chronic dry mouth entirely. The third step is to pay attention to your electrolyte intake and not just your water consumption. Electrolyte-rich foods like bananas, leafy greens, avocados, and low-sodium broths actively support the function of the salivary glands in ways that plain water simply cannot. If you eat well but still experience persistent dryness, speak with your doctor about whether an electrolyte supplement might be appropriate for your situation. The fourth step focuses on protecting yourself during the night, which is when microaspiration and bacterial movement are most likely to occur. Elevating the head of your bed slightly, even by a few inches, reduces the chance of bacteria traveling down from the mouth into the airway during sleep. Using a bedroom humidifier adds moisture to the air your mouth and throat are exposed to throughout the night. and replacing any alcohol-based mouthwash with an alcohol-free version removes one of the most common sources of nighttime oral dryness that many people never think about. The fifth step involves actively stimulating saliva production throughout the day. Xylitol-based chewing gum, which you can find in most pharmacies, is one of the most well-researched tools for stimulating saliva flow without sugar. Sour sugar-free candies create a similar response by prompting the salivary glands to produce more fluid. Eating crunchy vegetables like celery, carrots, and cucumber at meals also physically triggers saliva production in a natural and healthy way that benefits both the mouth and the digestive process overall. The sixth step is a direct and confident conversation with your doctor. I want you to know that you have every right to ask your physician for a salivary gland function assessment. This is a straightforward evaluation that can identify whether your glands are functioning at a reduced capacity and why. Too many older patients assume their doctors will bring up these things unprompted. In reality, the health system moves quickly, and your voice in that appointment room is essential. Ask the question. Request the assessment. You deserve that level of attention to your health. The seventh and final step is knowing exactly when dry mouth crosses into emergency territory. If you ever experience dry mouth alongside sudden difficulty breathing, confusion or disorientation, chest pain of any kind, or an unexplained fever, do not wait. Do not try to manage it at home. Go directly to the emergency room or call for immediate medical assistance. These combinations of symptoms can indicate that bacteria have already entered the lungs or the bloodstream, and time becomes critically important in those moments. Margaret's story did not end in that hospital bed. After her medical team conducted a thorough review of her medications and made careful adjustments, her dry mouth began to improve significantly within just a few weeks. Her swallowing became easier. The chest infections stopped returning. Her appetite came back. She began to regain the weight she had lost. Within several months, she was back to her normal activities, back to her garden, back to the reading groups she loved. Today, she speaks openly with other seniors in her community about the warning signs she wishes she had known 18 months earlier. She tells them exactly what I am telling you right now. This symptom is not nothing. This symptom deserves attention. If you woke up this morning with a dry mouth and you are still reading or listening to these words, I am asking you to do one thing before this day ends. Write down your symptoms. Write down every medication you take, and make an appointment to speak with your physician. Not because something is definitely wrong, but because you have every reason to find out whether something could be addressed before it grows into something serious. Your body communicates with you every single day through small signals exactly like this one. Dry mouth is not your body failing. It is your body speaking. The question is simply whether you are ready to listen and to act on what it is telling you. The people who thrive in their 60s, 70s, and 80s are not the ones who never face health challenges. They are the ones who pay attention early, ask questions without hesitation, and take small steps consistently toward understanding what is happening inside their own bodies. If this information feels important to you today, please share it with someone you care about who is over the age of 60. There are people in your life who are waking up every morning with this same dry feeling and dismissing it the same way Margaret did for 18 months. A single conversation could genuinely change the direction of their health. And if you found this helpful, subscribing means you will continue to receive information like this, evidence-based, clearly explained, and always focused on what matters most for your health as you age. Before you go, leave one word in the comments below. If you experience dry mouth yourself, leave the word Margaret. If you are currently taking 3 or more medications, leave the word medication. And if today's information has made you decide to speak with your doctor, leave the word doctor. Your comment matters, and it helps other people know they are not alone in what they are experiencing.